Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
With age, we learn to accept the wrinkles, the gray hair, and the bags and sags that go with it. But for many, incontinence can be an inconvenient, embarrassing, unacceptable, and not necessarily normal part of aging. So what happens in the body that causes lack of control or leakage, and what can be done to control, cure, or conceal this problem? I'm Janet Whitmoyer, and you're watching Healthy Living for Life, a show dedicated to helping you do just that. Stay tuned. My first guest is Dr. Richard Slater, a urologist with Great Falls Clinic. Thanks, Dr. Slater, for being with us.
Thanks for having me.
Absolutely. So let's start off first by having you tell us just what urinary incontinence is.
Well, urinary incontinence is simply, losing urine, and sometimes that might be functional, meaning you can't help it. Sometimes it's because you have the urge, we can't make it to the bathroom in time, but urinary incontinence is simply the inappropriate or involuntary loss of urine from the bladder.
And how common of a problem is it?
Surprisingly, it's actually pretty common, and obviously I see a lot of it, but about 13 million people in the U.S. suffer from urinary incontinence of one form or another.
Wow, okay. So is urinary incontinence a normal part of what you'd call aging?
No, I think we oftentimes think that, our people come into the clinic thinking that urinary incontinence is the part of aging, and that's the sad part of it. But no, it can sometimes and oftentimes is a symptom of something else going on, either medical or, again, muscle atrophy and reasons why we might see urinary incontinence.
Okay. So can you tell us a little bit about what some of the risk factors might be for somebody to have urinary incontinence?
Sure. Well, obviously age is a risk factor. As you age, there are definitely changes, functional changes that happen at the bladder that can lead to incontinence. But there are other medical conditions that might be at risk factors, or lifestyle choices such as the foods you eat, or even being constipated may be a reason for having incontinence.
Okay. So I wanted to ask you a little bit of a follow-up on the foods. What type of foods would cause urinary incontinence?
Well, certainly, so foods that cause the bladder to be irritated are oftentimes the ones that are causing urge incontinence, or the loss of urine because you can't hold it. Those are spicy foods or caffeinated beverages are often the culprits there. Okay. There's a whole host of them, but those are the most common ones.
Okay. So is urinary incontinence considered a disease?
Not necessarily. It's usually a symptom of something else going on. It could be something underlying, like a urinary tract infection.
Okay.
Maybe even potentially a cancer, but again, that's pretty rare.
Okay. So are there multiple kinds of urinary incontinence?
Yes, there's a few different types of incontinence. I guess you could broadly categorize them into stress or urge incontinence is really the two major types.
Okay. Can you tell us a little bit about the difference between the two of them?
Sure. So stress incontinence is when urine leaks from the bladder, you lose urine inappropriately because you can't hold it in from coughing or sneezing, if that makes sense.
Yes, absolutely. Okay. And then, so stress incontinence, that's stress incontinence?
Stress incontinence. So urge incontinence would be the inability to make it to the restroom in time because you feel like you have to urinate, but you just can't make it there, and your bladder's squeezing in the midst of that.
Okay, all right. So can you tell us some ways that maybe people could use to manage stress incontinence?
Sure. So stress incontinence is usually managed depending on the age and depending on what the causes are, but oftentimes stress incontinence is managed with surgery. There are really no drugs available to treat stress incontinence, so really it comes down to pure stress incontinence is typically treated with surgery.
Okay. What kind of things do you do surgically to manage that type of incontinence?
Sure. In females and in some males, pure stress incontinence is typically managed with a mid-urethral sling. Okay. It's a small vaginal surgery, outpatient surgery that's used to resupport the urethra, the tube draining the bladder to help replace the anatomic attachments to help with the loss of urine. Okay. Sometimes after a prostatectomy for prostate cancer, men might have stress incontinence that's really bad, and we may actually put an artificial urinary sphincter in place, which is a larger operation, but nevertheless something that's available for stress incontinence. Okay.
So, but neither one of them are major surgeries, something that can be done fairly easily for most people?
Usually they're either outpatient or overnight, just one night overnight stays.
Awesome. And so, in addition to stress incontinence, we did talk about the urgency. Can you tell us a little bit more about what urgent urgency incontinence entails?
So urgent incontinence, as we talked about, can be caused typically from having an overactive bladder from obviously, or things that cause the bladder to be irritated like foods or even some medications. Overactive bladder is mostly managed with behavioral therapies.
Okay.
That'd be the first thing, is kind of correcting those things that are causing it, or maybe underlying culprits, such as the foods or constipation. But if that doesn't work, there are medications available to help manage people with overactive bladders. And those medications fall into a few different categories. There's a number of medications on the market. Most of them are, they're anticholinergics, and there's one that works a little bit different. But those medications help slow down the bladder so you can hold urine longer.
Okay. And is there a way to treat an overactive bladder other than, like you said, medications? Or
well, behaviorally is obviously the first and foremost. I mean, adding medications is never something we try to do. So behaviorally, trying to increase the amount of time you might be able to hold urine between voids might be one way to slowly increase that time frame. Again, removing the offending agents are most common, the reasons or the best ways to treat urgent incontinence.
Okay.
And if you fail medications, there might be some small outpatient procedures that might be done to help with that, such as Botox to help relax the bladder. Or neuromodulation, which the bladder runs off of the pelvic nervous system, and so we've discovered that if you modulate these nerves, you can actually increase the bladder's capacity.
That's really interesting. So Botox, I just wanted to follow up on that. Is it an injection that you get for Botox?
Yeah, it's cystoscopic, so it's a procedure where you go into the bladder and you submucosally underneath the inside layer of the bladder, you inject small aliquots of a Botox that helps paralyze the nerves of the bladder to help increase the capacity of that bladder.
In about the last minute that we have, could you tell us, Dr. Slater, what you would like people to know about incontinence and how they can improve their lifestyle or live with incontinence so that it really they can actually deal with it a little bit better and not have to worry about being able to live a normal life?
Sure, that's a good question. So I think that the first thing I'd like everyone to know is that urinary incontinence is something that you don't have to just accept because you're aging, or accept because you had babies and you're wearing 7 pads a day, and you're wetting your pants all the time. So I think the first part is just the recognition that it's abnormal and that it needs to be brought to your attention. Obviously, you see your primary care physician or see a urologist to discuss further. But I think that it's something that you should recognize it's a symptom of something underlying, and we should look into it and potentially be able to offer therapy to help manage that.
Okay, awesome. Well, thank you so much for the great information. This has been very helpful.
You're very welcome.
Next up, learn about another type of incontinence. We'll be back right after the break. My next guest is colorectal surgeon with St. Peter's Health in Helena, Dr. Emily Bubbers. Welcome, Dr. Bubbers.
Thank you.
Earlier we were talking about urinary incontinence, but I know that there's folks that suffer from rectal or fecal incontinence. Can you tell us a little bit more about what that is?
So fecal incontinence is the lack of control of either air or flatus or stool. And it can be minor to once every couple of weeks, or it can be severe up to multiple times a day.
Okay, so can you tell us a little bit about what causes fecal incontinence?
The causes are many.
Okay.
The most common time we see this are in older women who have had vaginal deliveries with tears during that time. Radiation to the area can cause damage. Surgery in the area, anal and rectal surgery, can cause damage. Anything that can cause nerve damage, like strokes or back pain or diabetes, can also have an effect on continence.
Oh, okay. So is rectal discharge a form of fecal incontinence, or is that something totally different?
It's usually different. If you're having rectal discharge, we usually have to look for the reason for that.
Okay.
When we talk about fecal incontinence, we're usually talking more about stool.
Okay. So that's one thing that a person can really help differentiate when they're talking to you, whether it's stool or something else.
Yeah.
Okay. So how do you actually treat fecal incontinence, or can it be treated?
It's absolutely treatable. The first step is to see a physician.
Okay.
Number one is we take a long history about your stooling habits, your stool consistency, diet, your history, your medical history,
Okay.
any surgical history, and again, for women, gynecologic history. From there, we examine the patient in the exam room to do an anal rectal exam to look at tone, anatomy. A lot of times a patient should be up to date on their colonoscopy to make sure we're not missing any underlying cause for diarrhea.
Okay.
And then from there, we start a systematic workup through treating fecal incontinence.
Okay. One thing you mentioned was dietary issues. Can you explain a little bit more about how that affects incontinence?
So if you have fecal incontinence, it's much easier to be incontinent to liquid stool than solid stool.
Okay.
So a lot of patients have food intolerances that cause diarrhea. So identifying food triggers that can make your diarrhea worse is important, so those can be eliminated. Potential food allergies are important. And then fiber is a big part of any diet. So if you are not on fiber supplements, potentially adding those to help bulk up your stool.
Oh, okay, great. So I know a lot of people don't like talking about this, but it's important. And so really, how common is fecal incontinence?
It's probably more important than we know because
Okay.
people don't want to talk about it. It's hard to give a number.
Okay.
But again, it drastically affects somebody's quality of life, because if you're afraid of soiling your pants when you leave the house, you're going to be much more isolated. You're not going to go out to dinner. You're not going to go to birthday parties. So I think it affects women much more than men because of our gynecologic history.
Okay.
But again, if men have had surgery to the area, they can suffer from this as well.
Okay, so mostly women, but can affect men as well. Okay. And then you also earlier talked about uncontrollable flatulence. Is that also considered a form of fecal incontinence, or is that something totally different?
It's a lesser form because it won't necessarily ruin your clothing, but it can be quite embarrassing.
Right.
So it has less of a toll on patients, I would say, than stool.
Okay.
But it can definitely have an effect. And again, that we look at diet, and there are medications to control that.
Okay, so they might be able to help. Is there any other treatments that you can think of for that problem?
That is less. There are some minor procedures potentially out there, but that's less fixable from a surgical perspective.
Okay, so mostly diet and potentially some medication changes. Okay, so if you could give the readers or the listeners out there one message about this, what would be your take home to people that are watching this show about this issue?
So fecal incontinence is definitely more common. You're not alone. There are potential fixes, basic as adjusting your diet, adding fiber, and seeing a physical therapist. And if those don't work, we have other options, including sacral nerve stimulation. There are new devices on the market for artificial bowel sphincters.
Oh, wow.
That most people hear fecal incontinence say, oh, I'm going to need a colostomy bag. And that's no longer the ultimate truth anymore. So there are options out there. I would say don't suffer alone and come in and be seen so we can talk through it.
So a lot of the treatments that you were mentioning, are those available locally, or would you have to go to a big center for some of that kind of
Sacral
care?
nerve stimulation is present here in Montana, not in Helena. Some of the bigger operations you do need to leave the state for.
Okay.
But the majority of patients respond extremely well to diet modification, fiber, and then physical therapy.
Okay, perfect. So take home is don't let the embarrassment or issues of not wanting to talk about it stop you. Go in and see your doctor.
Correct.
Okay, well, thanks so much for the great information, Dr. Bubbers.
You're welcome.
Up next, you'll learn how physical therapy can help you gain control of incontinence. Stay with us. My next guest is a physical therapist who can help people with incontinence gain control. Welcome, Tara Phelps.
Thank you.
First of all, I was hoping that you could help us understand how we can control incontinence through physical therapy.
So it depends what kind of incontinence you have. There's two different kinds of urine incontinence. There's stress incontinence, which is urine leakage with coughing, laughing, sneezing, any increase in abdominal pressure. That urine incontinence responds very well to muscle retraining and strengthening the correct muscles. And then there's urge incontinence, and that is urine incontinence when you're rushing to the bathroom and you can't make it there in time. With that urine incontinence, we look a lot at bladder behavior, bladder habits, and develop a bladder retraining program. And then there's mixed incontinence, and that's a little bit of both. That is the most common and typically what I see in physical therapy.
Okay, so can you tell us a little bit more about the specific types of physical therapy that you would use to treat these different types of incontinence?
So one of the first things I have people do when they come in is I'll have them fill out a bowel and bladder diary and a food log and look at the things that they're eating and drinking throughout the day. I check for bladder irritants, teach people to decrease the amount of caffeine, carbonation, alcohol intake. I talk a lot about dehydration, making sure they have enough water. A lot of people are under the impression if they decrease how much water they're drinking, then they'll have to go to the bathroom less. That actually makes things worse because it concentrates everything in your bladder. Avoiding constipation is a big thing to focus on. And then we work on retraining the right muscles and strengthening the correct muscles. And so I'll develop an individualized strengthening program for the patient. If those options don't work, we can use biofeedback. That is a computer system that the patient is hooked up to, and I'll have them contract and relax those muscles, and there's graphs and audio tones and pictures, so they get the feedback if they're using the muscles correctly. If none of those options work and the people need a little more help, we can use electrical stimulation, and that just delivers an electricity current to those muscles to facilitate a muscle contraction.
Okay, so I want to go back to the muscle exercises or the training that you do. Can you tell us a little bit more specifically of what types of therapies or activities do you do to help with that?
To strengthen those muscles, so those are your Kegel exercises that everyone talks about. Okay. And most people who try Kegels on their own cannot do it correctly. And this is because these pelvic floor muscles are at the bottom of your pelvis. There's a lot of stuff on top of them. You have all your internal organs and they're kind of buried. So I use the analogy like if you're gonna work your biceps, you can see it, you can feel it, and you know it's working. Your pelvic floor muscles, you can't see those. If they haven't worked for a long time, then you might not be able to feel them. So a trick that people can try is if they stop their flow of urine, that it is those same muscles. I let people try that one time. Don't get in a habit of doing that because that can cause other problems, but it is those muscles. And so you squeeze those muscles and then you can relax them. If you are squeezing your abdominals, you're not using the right muscles, or if you're squeezing your glutes together, you're not using the right muscles.
Okay.
So I tell people if you're doing a Kegel, no one should be able to know. So if you're bouncing in your seat, you're using the wrong muscles.
All right. It's the silent and nobody knows what you're doing.
Yes.
Okay. So if somebody can't do Kegels, is there other types of muscle training that can be done to help them?
So sometimes we tie in a few muscles that are close to those other muscles. So you can use some of the hip muscles. Sometimes if they can't work the pelvic floor muscles on their own, then we can focus on the abdominals. Most people can figure out how to use these muscles.
Okay.
That's when we'll use the biofeedback system, so that computer system to help retrain those muscles.
Okay.
Or the electrical stimulation if they have something else going on that is limiting their ability to control those muscles on their own.
Okay. I wanted to go back to the biofeedback therapy. Earlier we had talked with Dr. Bubbers about fecal incontinence. So I wanted to ask you, does biofeedback therapy, is that something that you could use for fecal incontinence?
Yes.
Okay.
So the exact same way that we treat urine incontinence, we can treat fecal incontinence.
Okay. Oh.
And it's using a similar group of muscles, just a few different ones with the fecal incontinence, but it works the exact same way.
Okay. And I kind of wanted to shift gears a little bit and talk about women who are postmenopausal. Do hormones, or actually the lack thereof, play a role in incontinence?
Yes.
Okay.
So when someone goes through menopause, their estrogen levels decrease. When this happens, the tissue properties and the properties of those muscles are a little bit impaired, so they can become thinner.
Okay.
And as they become thinner, they can become weaker and not work quite so well.
Okay. So do you use physical therapy there, or would that be more of a different type of therapy for those situations?
Yes, physical therapy is very common after childbirth or when someone goes through menopause. Some of these issues happen because of a life event like that.
Okay.
Other times it's just a normal part of aging, things become weaker.
Okay.
So physical therapy is very common after menopause.
Okay. Tara, I only have about a minute left, and so I wanted to ask you, because this is really an important issue that a lot of people don't know how to talk about, or maybe are uncomfortable talking about, what would be your take-home message for anybody who might be having an incontinence problem? What would be the message you'd like to share with them about this?
So my big goal is to raise awareness with people and know that there's something that can be done to help you, and there's people out there that want to help you. I would recommend, before someone comes to a physical therapist, to go to their doctor first and get screened. Incontinence can be due to other issues or something else going on, medication side effect, or a neurological condition. So.
Okay, perfect. Thank you so much, Tara, for this excellent information.
Thank you.
We're about out of time for this week. I want to thank my guests for helping us get a handle on incontinence, and to encourage you to seek help from a professional, because incontinence doesn't have to ruin or run your life. Please tune in next week, and until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.